Record this computer. There we go.
There you go.
Okay, so we have with us today Emily Oster, economist and author of Expecting Better and Cribsheet. Emily, thanks for joining us.
Thanks for having me.
All right, so with all these interviews, we're starting by going back in time and trying to think about what we know when. So in March, tell me about how you're like processing the information that was coming out from Italy, from Europe at that point in time in March, and how did you think about the types of decision making that was taking place at that early in the pandemic?
Yeah, I mean, it's hard to even think back to that. It feels like it was like infinity time ago, and I think that it partly like what I recall from that time was just the feeling of like, okay, this is gonna be over soon. Like we'll get through this, and then it will be over. In a sort of simultaneously that, and also this like incredible fear, particularly the stuff that was coming out of Italy, and some of what was coming out of New York felt sort of like apocalyptic, right? So some of the sort of health stuff in Italy felt really like hard to sort of contemplate. But at the same time, there was this sort of like lockdown piece of it, the kind of personal life piece of it, which felt more manageable at the beginning because it felt somehow time limited, even though now when I think about it, like, I don't know how I would have thought that was time limited, but it felt like, okay, we're going to do this and we're going to, make some bread and hang out with the kids and learn a little extra math. And then we'll all be back in school. And I think it was sort of like a slow process of realizing, okay, it's actually going to be a pretty long time before we're kind of back to anything that looks like normal.
But were there any particular set of evidence that you're looking, or any models, or as sort of professionally, did you take any interest professionally on it right away when the information was coming out and decision makers were saying, oh, we need to lock down, for example?
Yeah, so I started very early on working with the state and doing a lot of work with their modeling team. So sort of thinking about these models, and I will say very quickly, I kind of realized that these epidemiological models are like, I'm very sensitive, right? And
bad.
so
you can say bad. I can say bad here.
I'll say it. You don't have to. Let's just say they're sensitive. They're sensitive, and so there would be sort of this like whiplash between like there are going to be 2 million deaths, and then the next would be like there's going to be 60,000 deaths, and now there's like and you sort of realize, of course, when you think about it, why that's true of these models, because they have this exponential growth feature, and so relatively small changes early on lead to sort of very large changes later. And so I was working a lot with the state, looking at those models, thinking about what the models were saying, but it was daunting and kind of difficult to get our heads around it, I
guess. But were you sort of so when looking at that, right? And I think we had a very similar experience here. I was involved early on with some decision makers locally here, and when some epidemiologists show up to the mayor, to the county, or to the governor and say, listen, if we don't do something right now, 18,000 hospitalizations are going to take place in Austin, Texas. Well, that didn't happen in New York City. So it's kind of like, in retrospect, right? There was like but it was like a hugely scary moment at that point in time. And then people react and go into lockdown mode, right? But one thing that I felt that was not really front and center in the discussion is something that you spent a lot of time talking about and writing about, which is the trade-offs that you're facing. At that point, it seemed that no matter what, we need to do this, regardless of the price that we're paying for it. And I can understand from the sort of like temporary, maybe a 2-week period or something like that, right? But I don't think there was enough thinking through would you do it if it was a 6 months lockdown? Was there any kind of calculation that you saw taking place in that sense?
Yeah, I didn't. I mean, I think early on in that period, there was so much push of just like lockdown, which again, I think there were good reasons to do. There are good reasons to do some lockdowns. I think part of what, but I think you're right that there was a sort of short-termism of this, and kind of we conveyed to people we're going to lock down until we can like fix the hospitals, until we can like get enough hospital beds, so we can like be ready if there's like whatever. But then that sort of morphed into like we're going to lock down until there's not going to be any more coronavirus, which I think it was like not really realistic. And then you get people who push way back in the other direction, right? And so I sort of worry a little bit that we got into a situation where we were kind of like asking people to do something they couldn't really sustain for very long. Like locking down for 2 weeks, for a month, I think is more feasible. Doing this for 6 months is just not something that like people are really equipped to do in this in the face of this. They're just not really equipped to do that.
Right.
And so then you kind of lost by having such extreme things. You lost the opportunity to give a more nuanced message of like, you know, actually you do need to wear a mask and wash your hands. And some of those smaller steps, if we had pushed those more at the beginning, we might have had an easier time getting people to adopt them. So I think there was a little bit of a balance there that maybe was not especially well thought through in the first moments.
And I remember, I think one of the first things I read from you during that time was exactly making that point, right? Making the point that, and it's not something that is unique. It's only you know about it. That's something that behavior economists know about it, right? How to convey a message in a way that you get more buy-in, as opposed to the sort of uniform thing that seemed to be maybe too arbitrary and then to not just doable. So if I cannot do you know, if that's the only solution, let's not do anything type thing, right?
Right. Yeah, exactly. That sort of people got into a place where it was like, well, if I can't stay in my house for the next 2 years, like I might as well just go out and like have a party. And it's like, well, no, like there's this sort of intermediate thing, but we somehow like failed to get people to, we failed in conveying that, I think.
So was there anything in particular in terms of the sort of potential costs they were facing? Once you realized that it looked like the lockdowns are not going to be a one month, would be something that, you know, when politicians primarily start almost like talking in terms of, yeah, we need to crush the virus. Now we need to think about lockdowns as not flattening the curve, but rather suppression, right? Try to suppress the virus from existence. And we had too much community spread already at that point for that to be realistic, right? Then were there particular costs that you were worried about, things that people were not necessarily focusing on that they were like, oh my God, this is going to be bad in this way.
Yeah, I mean, I think that, you know, it was, I think there were costs to kids that we hadn't sort of like seen at the beginning, right? And so I think a lot of people probably underestimated the cost of of having kids out of school, both in a learning sense, but also in a mental health sense. So I think that the mental health piece is probably the piece that I didn't hear people talking about at the beginning, because I think people didn't understand what it was going to be like. And then you sort of saw like just things get kind of worse and worse. And I think really for both kids and adults and older adults in particular, the kind of like mental health damage of some of this isolation is really has been really extreme. And I don't think we're done seeing that. You know, I think that rates of depression and anxiety and all those things are going to end up being way higher than we had expected. And I think that's something I did not see a lot of discussion at the beginning.
Is there any evidence of that right now already coming up? Do you find any studies that are kind of compiling that information or not?
Yeah, I've seen a few things sort of about like rates of depression, but I haven't seen anything really like comprehensive. You know, I'm wondering what we're going to see about overdoses. So, you know, sort of drug related stuff. You know, for some of the same reasons.
Right, and that's not only isolation, but also like, you know, losing your job is something that contributes to those things a lot too, right?
Exactly.
Yeah, I remember one of the first days after maybe a month or so of isolation here, we had some friends over to play in the backyard, and the kids were so happy. It was such a real, you know, there was one particular kid that my 2-year-old never met before, and he was so excited about just having another kid to play with, and seeing that was like, oh, wow.
Yeah, my kids went to camp like 2.5 weeks ago. It was like the first like time, maybe 3 weeks ago, like the first time that they had like been in a child camp. And I had understood that they missed seeing other kids, but the like difference at the end of like 2 days in just everybody's mood and the ability, it was just like, I mean, and it wasn't just like the work time. It was sort of that like everybody at the end of the day had like something different that they had done to talk about. And I don't think we had really appreciated how much the kids had been sort of suffering, even though like, of course, like they're very lucky and we're in a very lucky circumstance, but they kind of need other kids.
So let's fast forward to where we are now in terms of what we know and how different the information is from then. I think, you know, primarily the thing that we know now that we didn't know then was how heterogeneous this disease is in terms of risks for different populations, right? And for us, it's something that, you know, is very, very low probability of something real bad happening, whereas for some groups it's very high probability. So, you know, given that, I think that the original data points pointing to, not data points or projections pointing to like millions of deaths, we're kind of like negating that and rejecting those hypotheses now, I think, to some extent. How do you see this moving forward in terms of policy or
I am not sure. Yeah, I mean, I'm not sure. I mean, I think that there's like also a sort of huge disconnect across space in how people are thinking about this. So, you know, like there are definitely places like in even places that have really high rates, like in Texas, where I think people are sort of like, okay, well, let's just like move on. And, you know, yes, it's too bad that we have so many coronavirus cases, but we're still going to like open our schools, and we're going to, and then I think that there are places like, you know, New York and California and where I live, where like even in the face of much lower risk, the choices that people are making are much more conservative. And so, you know, I'm not sure where I see all of that going. And I think it's also been hard to kind of it the thing you said about heterogeneous impacts is been very difficult for people to think about. And so we sort of simultaneously, we see like huge numbers in terms of cases, but it's hard to translate that into like how how worried should I be, which is a sort of a thing I think a lot of people are struggling with.
So let's go talk about kids. That's something that you did a lot of work. And I should say also that you've been maintaining a website with Galit Alter from Harvard on compiling a lot of information about kids, about families, about treatments, and like basically a lot of evidence, gathering a lot of evidence and making it easy for people to digest that. So give me an overview of how should we be thinking about COVID in relationship to kids. I mean, you mentioned your kids being in camp, so tell me more about that.
Yeah, I mean, I think that basically what we know about kids is that their risks are relatively low. That, you know, they themselves are both relatively less likely than adults to be infected, and the outcomes tend to have fairly mild infection. You know, I'm always cautious to say like that doesn't mean that kids cannot get very sick, and doesn't mean that kids cannot die of this. Like we have seen pediatric illness and we have seen pediatric death, but it's just much less common, you know, relative to sort of broader, like older people. And the reason partly that that's surprising and that's like notable is with many respiratory viruses, like if you looked at something like the flu, the groups that you would see would be most effective would be young kids and older people, right? So if you look at like who dies of the flu in a given year, it's kids and the elderly.
Very, very young kids, right? Yeah.
Very young kids, exactly. Sort of like very young, like kids sort of below 5 kind of kids. Here, there's really like very young kids seem to be like basically the lowest risk group. There's almost like a kind of not linear, but there's almost just like a monotonic increase across ages. And I think that, you know, we don't really understand why that is, but it is encouraging about kids. And it means, you know, when we think about the risks of kids, like it's not that it's zero, but it's much lower than some of the other disease risks that you're taking in like a bad flu season or something like that. And so I think that's good. But then when we think about childcare settings, of course, there's a question of like, are kids transmitters? And I think the evidence there is a little bit more complicated. So, you know, kids do seem to transmit probably less than adults, partly because they don't have it as much, particularly very young kids are just not very efficient transmitters. They're rarely the index cases in their households. It doesn't mean they can't transmit, but it doesn't seem to be very common. That's encouraging about sort of childcare and schools, but again, you know, kids do get sick.
Relatively low relative to other groups in the population, their risk. But can you put it in a way that relative to other things that we do, how would you rate the risk of, you know, is there like an analogy you can make between the risk of a kid dying of coronavirus relative to other things?
You can look at something, you know, early on in the epidemic, I looked at like, you know, flu deaths and COVID deaths in the last, you know, and the flu deaths are, I don't know, 10 times, 15 times as high as the COVID deaths, even in the sort of height of the epidemic early on.
Which was an incredibly mild flu season, this one, right?
It was not a very significant flu season.
Right.
Yeah. So in a, you know, relative to a serious flu season, that would be very, very different. So I mean, we're talking about very, very small numbers, you know, very small numbers.
Yeah, that's something that's very hard for people to digest, right? And especially when they see the sort of still apocalyptic news around them, it's hard for them to see.
Yeah, I think it just makes it really like, you know, the one thing I sometimes tell people is like, if every time a kid drowned in a pool, you had the kind of coverage that you have when a kid is seriously ill from COVID, like you would never take your kid anywhere near a pool.
Right.
And I think there is this kind of salience piece, and it came up early on. People are talking about like this multi-symptom inflammatory syndrome, which is sort of like a word for the kind of more serious illness. Yeah, Kawasaki like illness. And people are talking about that. In New York, it was like there's 100 people who might have this. It was like, like 20% of the kids that we're testing in New York have antibodies, suggesting that like the number of kids who had this is very, very big. And so sometimes I just tell people, like, remember, like, these places are really big. Like the denominators are really, really large. And so 100 may seem like a big number to you until you realize that the base rate is, 500,000, and then it doesn't really seem like that big a number.
Right. I think that the total number of kids that die in New York were 13.
I don't think it was that high, but yes, it's certainly not higher than that.
But up to 17 years old. So
up to 17, yeah, up to 17.
I was making a distinction. Big difference between 0 to 10 and 10 to 17. Yeah. Most of them came in the 10 to 17 years old.
Yeah.
So that's another question. A question that follow up to that. When there's a lot of conversations about, and we can talk more about schools in a second, but and they tend to bundle together K through 12. Would you make a distinction between what we know about, let's say, even pre-K kids, K through 5 elementary school kids, and then older kids?
Yeah, I would make a distinction in two really important dimensions. So one is just the risk of illness. So it seems like teenagers particularly look kind of a little bit more like adults, or at least are higher risk than very young kids. So if you had to say like what's the safest kind of group to have interacting with each other, it's very the younger a kid, the better, effectively. But then the other thing is, when we think about things like schools or interactions, and we ask like, how efficiently can we replicate the experience of that, like these, the sort of things you need to learn with a 14-year-old on the computer versus like a 5-year-old on the computer, those are really different, right? So like online learning, it's not great. I mean, you and I both teach like adults basically, and it's not as good. Teaching college kids on Zoom is not great. But they are learning something. They are able to sit in front of their computer and Zoom, and they're able to do worksheets, and they're used to working on a computer, and they can type, and they can talk to their friends on the phone, or whatever it is.
Troubleshoot, happens.
Exactly. But my 5-year-old can't really do that, right? And so, it's really hard to teach a 5-year-old to read on Zoom. It's just really hard to do that. And so I think that I would draw a distinction between, if you ask me like, what's the most important set of people to get back into the classroom in person, it's little kids. Elementary school, right? So like a condition on so there's 3 things that I think there's a lot of worry about right now when it comes to schools and in the rhetoric that you hear, which, by the way, you mentioned Texas opening schools. We're not, actually. So we just heard from there's a big push from our teachers not to open schools, and I think we're going to be at least online for the first half of the semester, which is and at the same time, also not only public schools, but there was cities are putting constraints for private schools and charter schools to open as well. So I think that's interesting. Yeah, because I heard from people who have private schools in Houston that said like we're opening normally.
Yeah, but just this week they started sending basically directives that they are not allowed. So there's some lawsuits coming up. This is not decided by any means, but there's this discussion. And I think when you hear the discussion, there's 3 pieces that people tend to point out. One is risk to kids, and I think that's the one that the data is just overwhelming. It's overwhelming that we shouldn't worry about that. There's again, I have a pool in my house, and I shouldn't have it. If I have a pool in my house and I don't send my kids to school, I'm being completely irrational.
Yeah. That's not consistent. Yes.
Yeah, exactly. Inconsistent. And the other piece is, but there's the teachers and the custodians and the other people that work in school, and they're putting them at risk. Is that fair to them? You talked about the transmission aspect, the fact that kids are much lower vectors that they transmit, but they transmit at a much lower rate than other individuals. And I don't know how you think about that. How do you think about the teachers and custodians and other people that work in that environment?
Yeah, I mean, I think it is it's a very tricky thing to talk about. So I think we could talk about it in terms of data, and we could say like sort of let's look at places like Europe, which has a lot of differences and whatever, but like places like in Sweden, they kept schools open, and actually they had like a pretty they didn't have like a great epidemic experience overall in Sweden. But when you look at like hospital, you can match like occupation to hospitalization rates. So you can actually look at like whether teachers are more likely to be COVID cases than other jobs. Like what's a risky job? And teacher is not a risky job. So it's not that no teachers get COVID in Sweden, but they're not more likely than the general population of just like people with like random jobs. Unlike say bus drivers. A bus driver is like a super risky job. Okay. can kind of see why that would be. So, you know, it does suggest that this isn't like an especially high risk occupation. Of course, I think there's you know, people say, well, like, why should I have to, you know, why should teachers have to go back to school and put themselves at, you know, put themselves at risk? It's not fair to ask people to do that. It's like a little bit of a funny thing to say, because of course, like, you could ask the same question about like people working in grocery stores. Like, why,
Yes.
like, why do we ask, you know, or people who like, I mean, doctors is one thing, but like, you know, it's not like there are no other jobs where you have to go, otherwise you are not working. I mean, of course, it's not indentured servitude. Like, if you don't want to go teach, you don't have to go teach.
Right.
But I think so I think that there's a little bit of a sort of tension there. I do think that there are some very legitimate complaints on the teacher side, which is that they're not being provided with the kinds of like protections that they need, right? So it's one thing to say, you know, look, you can wear a mask, your students will wear a mask, we're going to track their symptoms, we're going to kind of do everything we can, but we expect you to come back to work. There's a difference between that and saying, like, you have to come back to work and we're not going to provide any support, and, you know, good luck with that. I think that's not really fair. And that wouldn't be consistent with like being a cashier at Whole Foods, where they put up the plexiglass and they have you wear a mask and they make the customers wear a mask. I mean, I think that's not an unreasonable comparison.
Yeah, and I think that we decided to use this term of some business being essential versus not, which I think is an incredibly dangerous thing for, you know, a central government to decide what's essential, what's not. But if you're going to do that, schools, I would claim that
seems essential, right?
Seems essential to me.
Seems essential.
So I hope they'll come in. Yeah, but you make a good point of I think the lack of preparedness in a lot of school districts. But in that sense, do you, places that, let's say, will open, do you have any information on the types of things that seem to be really important to do? I absolutely agree with you that yes, the kids are wearing masks. If the kids are somehow protected from the teachers, I think somehow staying some sort of social distance from teachers is something that seems to make some sense. But I think the idea of trying to spread kids around 6 feet away inside of the classroom seems a little crazy to me, given what we know about their transmissions and their risks. And I don't know, how do you think about that?
I mean, I think it's just not realistic, right? So I think we have to sort of, there's like a kind of combination of like what is safe and what is like realistic to expect kids to do. And I think there are some things which are real, like which we can do, which are realistic, like which are like wash your hands more, wear masks, you know, do some symptom tracking, like take kids' temperatures, like don't have sick, you know, tell people they can't have their sick kids to school. So there are some sort of external things. I think when we start and you know, keeping kids in smaller pods so they're not interacting with a million different people, which will make it easier to like contact trace later if somebody does get sick. So there are some things like that. Regulating precisely how the kids interact with each other in the classroom, I think, is just very, very difficult to imagine doing. And I don't think the evidence would suggest that is very important, that is like necessary to do, but I also think it's impossible, right? And so I think there's like some frontier of like what is effective and what could you do, and we need to sort of figure out how to be on that frontier with these different things. Like, what are the things that we can do that are effective, and we got to kind of give on some of these things that are just impossible.
So you know, I don't want to put you in the spot, but would you say that given then what we know and the evidence and what we are in the epidemic, I guess the third thing that I didn't mention is that the one worry is that, well, the impact that having schools open have on the progression of the epidemic. That's the other thing that one could think about schools as being a compartment in those models, right? And how do they lead to sort of the progression of the exponential growth, so on and so forth. I think then again, the evidence is not, well, there's not a lot of evidence. What we have is really just like some guessing. And from what we saw in Sweden, for example, and some other places that had schools open earlier, it doesn't seem to contribute so much for that spread, right?
I think that's correct. Yep.
Putting all that together, would be your sort of assessment that the cost benefit is such that we should be opening schools fully on time this fall? Elementary. Let's separate them. Elementary or. And I know you when you know writing, you try to say, well, let me empower people with the information, let them make the decision. I don't want to make the decision for them. But here we're in a situation where states, you know, are making those decisions for us, right?
Yeah, I mean, I think if I were the decider, that in states with kind of under control epidemics, and I mean not zero cases, but I also mean not more like not a positivity rate of 10% and really like increasing cases, but places like the Northeast yeah, I would open schools on time, pretty normally. That would be my, I mean, I am just really like, I was reading something the other day in the journal was sort of like an anecdote was like a story about a woman, single mom with 2 kids, and like the kind of like inequality and learning losses that are going to be associated with this are going to be felt forever. And, I understand the view that if even one kid, dies of the coronavirus, it will be too costly. But I think that is not consistent with the other risk choices that we're making. And I think we really need to think about the costs on the other side. So I guess if I were the decider, maybe that's what I do.
So when you mentioned in some places where things are, I'd like to understand a little bit better that. So the fact that in a place where the epidemic might be raging with higher rates of positivity around, why would that be then the case for you to say that, well, in this situation, I would hope for schools to be closed?
Partly optics, actually. So part of it is that even if you thought, which I probably do, that actually opening schools wouldn't necessarily make things much worse or wouldn't make things worse. When you open schools, some people at the schools will have COVID, because like some people just like out in the world have COVID. And I'm not sure that we're really equipped to process that information appropriately. And so I worry that if we open, this is just like a practical concern. Like if we open schools and then the first thing that happens is the first week, a bunch of people who work in the schools, go to the schools, have COVID, that we will just shut everything down, and then it will be shut down every place, right? So I think, some of this is about kind of setting expectations. And there are definitely people who are more bullish than I am, who would say basically, because we don't think this will make things worse, like let's just open all the schools and just like let it go. And I can see that argument. I think that the sort of practical aspects of that seem really hard to me.
So you mentioned the differential learning and how that's going to have, it's kind of like almost obvious for us to expect this, right? That the kids that are more affluent are going to be able to handle this and manage this transition, whether they are doing online or in ways that are just easier than other kids. I think the gap of achievement is going to just be widened during this crisis. Another thing that you mentioned is how parents are going to handle this. And I think, do you worry at all about the desperate impact that we're going to see between men and women in terms of participation in labor force and so on, as a result of this?
Yeah, absolutely. I mean, I think you will see a ton of women, particularly actually like higher income, better educated women, who are just going to drop out of the labor force. And, there are going to be some like very significant gains lost. I mean, I'm thinking about this in the context of academia, where, we have like a bunch of people on the tenure track, and like some of them are women and they have little kids, and some of them are men and they have little kids. And the women who have little kids are home with their kids and they're doing the homeschooling, and they're, not writing papers at the same rate. And we're going to be seeing that in 5 years when we're looking at tenure cases. There's just no way around it. And I'm worried about
the thing that the policy, at least my university has, and I'm assuming yours has something similar, is that they delay everybody 10 years clock.
Yeah, us too.
And again, right, that actually know from some research that shows that actually
it makes it worse.
Makes it worse.
Yeah. I know, it makes it worse. It's really like, yeah. I mean, it's the same way I feel about like the childbirth clock extensions. It's like, oh, let's be fair and give everyone the same thing. Like, well, no. Do you know where the baby comes out of? Like, do you know who's like, just like to be totally clear, do you understand how these are not the same experiences?
Right.
My time investment is a lot more significant.
Right. But yeah, it's unbelievable. But those are the most liberal places in the world, right? University.
Right. No, exactly. These are the places most concerned with equality. I mean, I don't know. Maybe they're like too concerned.
So let's talk about vaccines for a second. You write a lot about vaccines and how that's like the one situation where it's like it's overwhelming evidence that yes, you should vaccinate your kids, and yet we have a very large number of people, and that's not COVID related, right? Before COVID, that still are reluctant to taking vaccines. Are reluctant because they think there's risks of this, risks of that, and so on and so forth. So here we are, in a situation where there are policymakers and academics that would advocate that we should stay locked down. It's so severe that we should stay locked down until a vaccine comes out. And then let's say miraculously in 3 months' time, a vaccine comes out.
And then people won't take it.
Right? From what you know, from what you observe and catalog in terms of evidence through the years of looking at this. So how do you think about like how quickly people will adopt and how the sort of like safety, because we're not going to have a lot of data on the safety of it. It's going to be studies and about it, right?
Yeah, it's an interesting question. I mean, I think we will see some, we will see take up because people will like want to have the vaccine. And then we will see some people who don't, who kind of don't want to have the vaccine. I think the thing the vaccine will buy us the same way the same thing advised us in the flu or the measles is the kind of like, it's on you if you don't do it, which I actually think will help a lot with some of the reopening stuff. I think part of what is tricky right now about some of the teacher stuff and so on is like, people are like, well, there's nothing that you can do and you're putting me in harm's way. If it's like, well, there's a vaccine, but you refuse to take it, I think that people are going to feel much different about that. So I think even the existence of the vaccine will help with some of that, even if people don't want to take it, which some people for sure won't. I mean, obviously, particularly if it's a Moderna vaccine and people like realize that it's a totally different technology that we've never used for a vaccine before.
Right. Don't say it.
Don't put that on. Don't put that.
Yeah, exactly. All right, decision making. Right. Let's think about decision making again. One of the arguments that I hear a lot is that, well, we just don't know enough about this. And for example, there's like people that worry about potential long-term consequences of it, or you mentioned the Kawasaki thing, like people see there's this other thing that can happen, and so there's a lot of like unknowns associated with what we have in front of us with this new disease, and because again, I think if we didn't have a system where, I don't know, I think in other times this just would be like another flu season. It'll be bad. People would be annoyed. Some people would die, and we'll move on with our lives. But I think the information that we have generated like a degree of panic and thinking that creates a lot of overreaction to it. But this unknown unknowns has generated a lot of minimax thinking. I think of decision making, thinking about the worst case scenario. Well, if I don't know, it's that something could be bad, therefore I'm not going to do it. Period. And that's like not how we tend to think about decision making. We we think about expectations, not necessarily min-max decision making. Again, in your work, you look a lot about how people think about decision making in race associated with their kids and family decisions they make. And that kind of thinking tends to take place in that space as well. Do you find a big difference between what we're living now, how this is taking place in people's minds versus that?
I think, to some extent, I mean, I think part of there is this issue of salience, which comes up to me all the time. Like, this is just so in your face all the time that I think it is very difficult for people to kind of step back and think, and like almost some of what our like risk decision making is benefiting from is the fact that we're just not thinking about these risks all the time. And so, sometimes you take a step back to think about these risks, but then you realize, okay, well, I'm not constantly obsessing about pools. And I think here we really are sort of constantly obsessing about this and reading about it all the time. And media is not super helpful because the media is like really focused on anecdotes and really focused on numerators and focused on case counts. And people sort of see these numbers and like the numbers are big and, or they're small, but they seem big, or they're more than one, or whatever it is. And I think that's making it very difficult for people to kind of conceptualize the decision making correctly. And it puts the kind of worst case scenario in your mind so front of mind that it is hard to kind of move it to the back of your mind, which right. You need to.
Yeah, and so changing gears a little bit. Actually, let me go back to one thing. We talked a lot about K through 12, and just to make sure that I know of some friends that would like to hear that. Daycares. What are the evidence? What are we, do we think differently at all? When you already mentioned that the rate, the sort of risk for kids at that younger age seems to be even lower. Yeah. And so even less worry about daycares anymore about K through 12.
Yeah, I'm less worried about daycares, in part because daycares are also much smaller. So like the sort of like most of the way that we are operating like daycare, childcare, little kid childcare centers is like well suited to having these small pods and doing things that are like, seem safe, in addition to the kids being lower risk.
Right. Okay, so now the other thing I want to ask now is about, it seems that there's a politicization going on with whether you want schools open or not. It seems that you are on one side of the aisle or not, and it's hard to understand exactly why there's yet another thing that falls into a partisan divide. Yeah. Ask Jesse some of these questions. I think he probably
right. He has to come in to get his sweatshirt in a minute because we actually have to go hiking in a few minutes. So you can ask him.
But I think that's a question that Richard wanted me to ask you, is the question of like, he's more on the side of like, let's try to be reasonable about this, have nuanced decision making, and not necessarily like blanket decisions of like everything closed, school closes or everything. And he's afraid that makes him into, not afraid, but he's being treated as like, oh my God, he must be a Trump supporter as a result. And that I think creates like a void in the conversation. If all of a sudden you think that I'm saying that schools should open because I support the president, it's like completely, that's a, it's like a lightning rod. And do you get that at all? That by you, tending to be in the direction of
No, it's super. I mean, it's sort of crazy because there's like this like unholy alliance of like the Trump supporters and then like the super lefty people who are caring about like inequality and in learning outcomes. Like somehow we're like on the same side, even though it's like not for the same reasons. But I think it has gotten, it's like the whole thing has gotten sort of very politicized, and it feels like there's not a lot of space for balance.
Yeah, and anything that you see positive in that direction in terms of any, I don't know, particular leadership that they are showing, good.
Nope.
Good ideas.
I have not seen any particular leadership on this. Sorry.
Yeah. I guess I asked everything that I wanted to ask. This is great.
Awesome.
Thank you so much.
All right. Yeah. Nice to see you.
And yeah, great to see you. And keep up the thanks for putting together for everybody.
Nice to see you.
I'll talk to you soon.
Bye.